Right now, over 300 million people around the world are struggling to breathe, and most of them don't even know why. They chalk it up to getting older, being out of shape, or just not being as active as they used to be. But what's actually happening inside their lungs is far more serious. Today we're talking about COPD, chronic obstructive pulmonary disease, one of the most common, most underdiagnosed, and most preventable lung diseases on the planet. So what exactly is COPD? At its core, COPD is a chronic lung disease that causes obstructed airflow from the lungs. That obstruction makes it progressively harder to breathe over time. The term COPD is actually an umbrella that covers two main conditions: emphysema and chronic bronchitis. Many people with COPD have both at the same time. In emphysema, the tiny air sacs in your lungs, called alveoli, become damaged and lose their elasticity. Normally, these little sacs inflate and deflate like tiny balloons, exchanging oxygen and carbon dioxide with your bloodstream. When they're damaged, they can't do that job efficiently. Air gets trapped, your lungs overinflate, and you're left gasping even after mild activity. Chronic bronchitis, on the other hand, involves long-term inflammation of the bronchial tubes, the airways that carry air into your lungs. This inflammation causes the airways to produce excess mucus, which clogs them up. The result is a persistent cough that just won't quit, along with breathlessness that gradually worsens over months and years. Now let's talk about what causes COPD and who is most at risk. The single biggest risk factor, by a wide margin, is cigarette smoking. About 85 to 90% of COPD cases are linked to smoking. The toxic chemicals in tobacco smoke damage the airways and destroy lung tissue over decades of use. But here's something many people don't realize. You don't have to be a smoker to develop COPD. Long-term exposure to air pollution, chemical fumes, dust, and even secondhand smoke can all contribute. In developing countries, indoor air pollution from burning wood or coal for cooking is a major driver. There's also a rare genetic condition called alpha-1 antitrypsin deficiency, which makes people susceptible to COPD even without smoking. What does COPD feel like? In the early stages, the symptoms are subtle, so subtle that most people ignore them for years. A morning cough, a little extra phlegm, feeling slightly more winded than you used to be after climbing stairs. As the disease progresses through its 4 stages, classified by a system called the gold staging system, the symptoms become harder to ignore. Persistent shortness of breath, wheezing, chest tightness, frequent respiratory infections, and fatigue all set in. In the later stages, something called a COPD exacerbation can occur, a sudden worsening of symptoms that can be life-threatening and often requires hospitalization.
The stages of COPD matter because they guide treatment. Stage 1 is mild. Stage 2 is moderate. Stage 3 is severe. Stage 4 is very severe. Doctors measure lung function using a breathing test called spirometry, which measures how much air you can forcefully exhale in 1 second. That number, called FEV1, determines which stage you're in. So what can be done about it? Here's the most important thing to understand. COPD cannot be cured, but it can absolutely be managed, and early diagnosis makes a dramatic difference in quality of life. The first and most critical step for smokers is to stop smoking immediately. Nothing else comes close to slowing the progression of COPD as effectively as quitting. From there, treatment involves several tools working together. Bronchodilators are inhaled medications that relax the muscles around the airways, opening them up for easier breathing. These come in short-acting versions for quick relief and long-acting versions for daily maintenance. Inhaled corticosteroids reduce airway inflammation. Pulmonary rehabilitation, a structured program of exercise, education, and support, has been shown to dramatically improve endurance and quality of life. In more severe cases, supplemental oxygen therapy becomes necessary. And for select patients, surgical options like lung volume reduction surgery or even a lung transplant may be considered. Here are the key takeaways from today's video. COPD is a serious, progressive lung disease driven mainly by smoking and long-term exposure to lung irritants. It encompasses emphysema and chronic bronchitis, and millions of people live with it without a proper diagnosis. The symptoms start small and grow over time, so early detection through spirometry testing is critical. While there is no cure, quitting smoking and following a comprehensive treatment plan can slow progression and help you live a full, active life. If you or someone you love has been experiencing chronic shortness of breath or a persistent cough, please talk to a doctor and ask about spirometry testing. Early diagnosis saves lung function, and lung function saves lives. If this video helped you understand COPD a little better, please hit the like button. It helps more people find this channel. Subscribe so you never miss our weekly respiratory health videos. And if you have questions about COPD or want us to cover a specific topic, leave it in the comments below. We read every single one. Take care of your lungs. They work hard for you every single day.